The scene at the testing facility is visibly different from what it was 11 months ago. In the early days, one would find people holding their heads still for a deep nasal swab. However, during our follow-up visit, we only found one person waiting for the procedure. Since March last year, medical staff manning the clinic spent half of their day covered in personal protective equipment. Dr. Ferland Almeida Sishea is the COVID-19 Chief Case Manager at the clinic and has been stationed here since March last year. In the early days, the pandemic brought some challenges to the health sector. Public and private health facilities reported lack of ICU beds, backlogs and delayed results at the Namibia Institute of Pathology, and these are just but some.
As you can recall, we were basically the only COVID center, we were only the only testing and screening center, so much so that even by then, Katutura Hospital and Central Hospital, the new respiratory units and the prefabs, were not even existing by then. So everything was literally coming to Robert Mugabe. In our isolation rooms, I think we only had 6 rooms by then.
The situation improved over time, and Dr. Almeida Sishea commended government and the private sector for responding promptly to the needs of the testing center. They work in moments of uncertainty, and Almeida narrates to NBC News the night that had a toll on her.
It was literally a life, and that patient crashed 4 times, like literally died 4 times on us. And all this in the name of we didn't have space. It was during that time where there was no space in all the hospitals, private, And the thing is, we are a primary health center, so we don't have all the necessary equipment. If we have to intubate or put a pipe on somebody to have machines to breathe for them, you understand? We don't have that. So it was a very difficult time because the patient kept crashing, and I think I tore my scrubs. My face shield fell off. My mask was, at that moment I knew it's either I save this person and get COVID, or I try not to, and then this patient dies.
That night reminded her of the Hippocratic oath she took, that is to devote herself to the welfare of those committed to her care, and as they resuscitate the patient, a saving call from a specialist came in. A bed space has been found. Unfortunately, a couple of hours later, the patient died.
That was very, very heartbreaking. I wasn't fine. I really wasn't fine.
It has become a culture that Dr. Almeida Sisea and her staff test themselves after every 2 weeks. For the past 11 months, she has known no other vocabulary but COVID, and she looks forward to the day she breathes a sigh of relief, more so with the vaccine on the horizon. Emil Seibeb, NBC News, Windhoek.